Hello, dear friends. Very warm welcome to all of you at our first MBBS guidance program. Myself, Dr. Shrikant Verma, Faculty of Anatomy at Cerebellum Academy. With me, Dr. Pooja Ringane ma'am for the physiology expert. So, in previous part, we had seen that what are our steps to clear the first MBBS exams, and also we had seen for the anatomy guidance. Now in this part, our excellent faculty of physiology, Dr. Pooja ma'am, she will guide you for the physiology, ma'am.
Thank you, sir, for the introduction. And in today's lecture or today's this video, we are going to see that how you should be, moving on into the physiology. Definitely, as you enter into the first year MBBS, it is going to be very intimidating year for you guys because there is a whole lot of shift that is going to occur from the plus one plus two to directly into the first year, right? So we are going to see over here that how to move on to the physiology and what is the comprehensive guide over here. So the first thing that we are going to talk about is the exploring the body intricate mechanism, that is how to keep the balance. The first thing that you are going to read or study in the physiology is homeostasis. You have to maintain the homeostasis in your personal life, social life, and your medical career, right? So that is the thing that we are going to talk about. And please remember that each and everything matter in your medical career, right? So why the physiology is crucial, that is the first thing you should ask yourself. Because remember, physiology means normal body mechanisms. If you do not understand normal, you won't be able to understand what is abnormal, because you won't be able to differentiate between these two, right? So if you know the normal, that is your fundamental base is clear, your building is going to be very very strong, right? So as soon as the patient comes, you know what is normal and you can easily identify, yes, it is not normal, that means it is pathology. And what you're going to do when the patient comes to you with any pathology, you give any treatment, medicines, drugs, right? And you bring back that patient towards the normal back again, that is towards the physiology. So you are going to incorporate the pharmacology in that, right? The drugs, medicine that you are going to learn in the second year. So you are basically learning whole of the medicine, right? And the base is going to be your physiology. So please remember, the first year subjects are going to be your basics, and that is how, and they will decide that how you are going to move on further in your MBBS career.
Correct, ma'am. Ma'am, in previous video we had seen that in first MBBS, the students are coming to the anatomy department. They are learning the structure of the organ.
Yes.
And it is very beautiful curriculum by the National Medical Commission that the same organs are how doing their function at the physiology, for which our cerebellum team is always with you, ma'am.
Yes, sir. And we are going to talk more about the CBME, but just let's see what are the reference books are there in the physiology, and then we'll move on towards the practical based thing, and then we will be moving on into how to interrelate all the subjects with each other, right? So what are the reference books in the physiology? If I have to tell you what is the Bible, what is the Gita, Puran of the physiology, that is going to be the Genongs, right? Genong ka 26th edition is there in the market, and this is the important book. But the problem in this book is that this is a review book, right? What do you mean by review? For example, you go to a movie, right? And if I ask sir is very busy in his schedule, so if I ask sir, or sir ask me, for example, that how was the movie and what is the plot, so I'm going to give a recap in 20 minutes to sir, this was the story and this was the hero, this happened and that happened, right? So it is kind of a review book. They took all the concept and make a concise manner of it. So it might be very difficult to understand this book, but again, this is a standard book that you should have handy with you, okay? There is another book if you want to go with the stories, right? You like stories to read on and not just the concepts and the points, then you have the Guyton and Hall ka book. There are two types of editions, that is, first is your South Asia edition, and then you have the international edition. So these are the two books. Now again, these are the story books. Now what is the advantage? It is very very easier to understand. But then again, when you go at the end of the story and write the paper, it is going to be very difficult to,
Yes, ma'am.
memorize everything. That is going to be very, very thick book.
That is a very common problem, ma'am. We are studying this very
Thick
thick
book.
books, and at the time of the exam, we are having the blank mind.
Blank mind, yes. So what you have to do again, you have to write at the end of the story, you have to attach some stick notes or something like that, and just write what are the hero points are there, right? So just in this page, if the question comes, what are the points that I should remember, which I have to elaborate in the exam, that you have to take care in the Guyton and Hall ka book, okay? But as sir said that this is going to be very intimidating to look at the book and read everything, right? So we do have another books also for that. And if you feel intimidating, sir, what you'll say to the students?
रिमेंबर बच्चों, देर आर द लॉट्स ऑफ द स्ट्रेस, लॉट्स ऑफ द प्रॉब्लम इन टू मच सिलेबस, लेकिन याद रखना, रास्ता भी जानते हो, चलना भी जानते हो, तुम आग हो, तबीयत से जलना भी जानते हो, खुद को मोम न समझो जो झट से पिघल जाओगे, तुम सूरज हो, डूबकर निकलना भी जानते हो. फॉर दिस ऑल द हेल्प एंड द गाइडेंस आवर सेरिबेलम टीम इज ऑलवेज विथ यू.
क्या बात है सर, क्या बात है. इसी के साथ इस मूवमेंट के साथ लेट्स मूव ऑन टू द easier books. If I cannot understand, let's say, Ginong, or my English is not that good, so what I can do is I want the handy book, right? So what I can suggest you is go with the Indian author books. That is, we do have A.K. Jain sir's book, and then we have G.K. Pal sir's book. These two books I'll recommend you because they have, they are made on the basis of students' mindset. As sir said, that thick books, whenever you see at the time of exam, especially, it is going to be very, very, intimidating and very stressful to go through them. So you can go through these books, which are Indian author books, and they have very easy to go, the language is very easy, the flow charts are already made, the bullet points are there, so you can use these two books. With that, I have one more book that I can recommend you, that is nothing but the Indu Khurana's textbook of medical physiology. Okay, there are other books in the markets, but understand there are going to be some mistakes in those books also, so that's why we are not recommending here. But again, if your department specifically is using that particular
Correct.
books and your teachers are saying that read those books, so understand your intra-departmental exams or intra-university exams, whatever are happening, the questions will be made by your teachers, so you have to follow those books. Okay.
Dear student, this was the very good point, very nice point told by the ma'am. Please always keep this point in your brain, na? Okay, please, ma'am.
So, please remember that you said that you'll ask me that, ma'am, these many books you are recommending. How should I know that which book is best for me? Now, there are online sites where you're going to get PDF of all the medical books free of cost. Right. So what you can do is, first of all, whenever your curriculum is going to start, just one of the topic, read one of the topic from each of the book, and just go through that on the PDF version, right, which is free of cost, and you'll get an idea that yes, I can understand better by this reading this book, so I can follow that book. And for that matter, if you require that book as a hard copy, then you can buy those books, because understand the medical books, they are not going to be cheap, they are going to be a bit expensive, at least for some students. So what you can do is, there are online sites where the PDFs are free of cost. If not, you can just contact us, we can provide you those also.
Yeah, and also, ma'am, you can go for the college library.
Yes.
At the college library, you can see all the books.
Yes, there are going to be the books which are even we are not mentioned over here, and maybe your department is following that. These books must be there. So I will suggest is, before buying the books, just go through at least 2 to 3 books and decide by yourself that which book you are comfortable with, right? Because ultimately you are the ones who have to understand the books after reading it. Okay.
Correct.
Right. So with that, let's move on to the next thing, that is our practical physiology. What we talked till now is the theory part, and then we are going to move on to the practical ones.
मैम मेरा एक छोटा सा एक्सपीरियंस है कि जब हम स्कूल टाइम में होते हैं,
Yes.
उस समय हम लोग के लिए थ्योरी बहुत डरावना लगता है, बट एट दिस टाइम इन MBBS थ्योरी इज ओके, हम कुछ भी लिख के, बट प्रैक्टिकल्स दे आर टू मच डेंजरस.
Yes, why? Because again, you have to get 50% marks separately in your practical examination, information, please remember that, don't take it lightly, right? As anatomy, in anatomy, the dissection is very, very important. Similarly, in physiology, there are going to be the things which are important that we are going to talk about over here. The first thing about the books we are talking, so we'll continue with that. The books that you have to follow is any manual that is suggested by your university itself or by your teachers. In our university, in Delhi University, we follow A.K. Jain sir's book or the manual which is Guy's textbook of practical physiology. Himat, I'll suggest you please go through the Guy's textbook, which is very, very comprehensive and very, very important, because again, you're going to read the Himat over here, but as soon as you go towards the pathology, the whole pathology is going to give one particular part towards the hematology. So it's very important to understand the hematology. Then we have the another book which is given by Dr. V.P. Vashne and Mona Bedi ma'am. So that is known as Practical Physiology Students Workbook. In that, the benefit is that question and answers are also there. What kind of question the examiner can ask you, these are also going to be there in the manual. Then we have G.K. Pal's book also for the practical physiology. Right, coming to the labs now. The first lab that you are going to enter is the hematology lab. Right. So I would like to ask you that what was your first experience in the hemat lab?
आई कैन रिकॉल मैम इट वॉज वेरी डेंजरस, क्योंकि हेमाटोलॉजी लैब में जब हम जाते हैं तो हमको खुद की फिंगर को प्रिक करके खुद का ब्लड निकालना होता है. तो मुझे जो याद है कि मुझको तो बहुत डर लगता था और मैं दूसरे लोगों के पास जाता था, भाई अपना खून देगा क्या. सो दिस वाज द प्रीवियस एक्सपीरियंस. और बाकी मैम एक और बहुत कॉमन चीज़ ये होती थी कि लोग धड़ाधड़ बेहोश होकर के गिरते चले जाते थे.
ये रिकॉर्ड है, दिस इज अ रिकॉर्ड. एवरी ईयर वी डू हैव सच स्टूडेंट इंसिडेंट्स, राइट? एंड इन द फ्रिज वी डू हैव फ्रिज फॉर द एंटीसीडाज एंड different solutions for the practical purposes that we store into. But remember, in that fridge, one corner is for juices and all those cold drinks, because if the students fall, we have to take care of them.
Yes.
Okay, so that is the first thing. And for that, this is very, very relatable that we are going to ask you that क्या हुआ, डर गए?
Correct.
So this is the experience in your hemat lab, but it is again very, very important. Do not fear, it is the capillary blood, I understand, but again, as soon as you start doing it, you'll be getting more used to it, right? So again, this is the first step towards your surgical branches, right?
Correct.
And in this, you will understand that you are feeling that pain, the patient must be feeling that also. So there is an emotional component also
Right.
related to it. Yes, sir?
Perfect.
Yes, so that you have to understand. Then coming to the amphibian practicals. Now understand amphibian, in which we use the frog usually. Nowadays the experiments are banned because of some ethical reasons, right? But there are instruments which are going to be important. There are graphs which are going to be important. Remember, the physiology of the frog and the physiology of the human being are relatable. So that's why whatever drugs we are giving to the frogs, let's say frog's heart or the muscle, the same effect you can see in the patients which are human beings. So that's why if you want to learn what effect that drug is showing, that you are going to learn in the amphibian practicals, right? Moving on to these instruments that you all are going to see in the human lab and the amphibian lab, which we are going to have a different session on in the physiology lab per se.
Ma'am, this physiology lab, if students will go properly step by step, then they can win also the Nobel Prize in future.
Yes, you do have Nobel Prize in the physiology and medicine. Please remember, keep the open mind, so that you never know what thing will strike you suddenly, and you may divert your way towards that, and you may win the Nobel Prize, right? So if you get the Nobel Prize, do let us know, right? Or you have such thoughts of the research or something like that. The cerebellum is having open hand towards you guys, right? You can contact us, and anytime you can share the ideas, or you can ask us for the guidance, right? So that is the thing. And these kind of instruments, they will be shown to your second year, third year, and whenever you are going to go in the internship, right? You are going to learn the basis over there, right? So if someone asks me, what is the quickest way to a man's heart, then I'll say through the fourth and fifth rib, right? It is a very, very medical thing. Only medicos can understand that. Why I'm showing you this slide is that whenever you are going to go and follow your human practicals and clinical practicals, in that you're going to learn everything without cutting open a patient, where your heart is located, where your lung is located, how to identify the abnormality without cutting open the patient, right? And that skill you have to gain over here, and that we are going to teach you in the physiology lab. Your university is going to do it for you. So please, 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 whenever the practical sessions are going on, keep your mind open, and as many points you can gather, as much as information you can gather, please gather that and make a good use of your time, right? So over here the BP apparatus is shown, and how to take a BP, right? That is one of the vital thing that you are going to do in the internship. As soon as you are going to enter any ward, for that matter, you have to take the vitals of all the patients, right? And if you do not know how to take a BP, that is going to be very shameful thing, because again, that is a must know skill that is incorporated in your curriculum, right? So you have to know about it. Next thing is clinical examination. You have to again examine the patient. So how to go towards that system particularly. So over here the doctor is examining the abdomen or your deep tendon reflexes, that is motor examination. You'll understand all these things, that how you're going to go stepwise and how you're going to diagnose the patient without even giving many investigation, right? And that's how you are going to be a skillful doctor.
करेक्ट
Right.
मैम. एंड डेफिनेटली बेटा एक चीज़ याद रखना आप सभी लोग, यही चीज़ें आपको मेडिसिन वार्ड में करनी पड़ेंगी. अगर आपका ये फिजियोलॉजी प्रैक्टिकल कमज़ोर रहा तो मेडिसिन की हर चीज़ आपकी कमज़ोर हो जाएंगी. सो दिस इज़ वेरी इंपॉर्टेंट पार्ट ऑफ द अवर फर्स्ट MBBS फिजियोलॉजी डिपार्टमेंट.
Right, sir. So coming to the curriculum that is made of by the CBME, first of all, when I told you that there are going to be patients which you have to check, but in the labs, so you must be remembering that we ask our colleagues to be a patient for us for some time for the
Correct.
subject,
Correct.
right? So you must be having the experience that whenever we ask you to do something, you'll feel shy at that point, you'll have anxiety, because see, the girls are also going to be around you, the boys are also going to be around you, right? So you will hesitate.
Correct.
Same hesitation whenever the patient comes to you for the first time, he is also going to have that. So that will teach you the doctor's patient relationship, how you are going to maintain that, right?
करेक्ट मैम, दिस इज़ वेरी इंपॉर्टेंट पॉइंट. बच्चों एक चीज़ को बिल्कुल याद रखना, पेशेंट के अंदर भी इमोशंस है, उसके अंदर खून है, उसके रिलेटिव्स होते हैं, और ये सारी चीज़ों की टीचिंग आपकी फिजियोलॉजी डिपार्टमेंट से शुरू होती है. इट इज़ वेरी इंपॉर्टेंट पॉइंट टोल्ड बाय द मैम.
Right, sir. So there are going to be ethics that you are going to learn in that. ATCOM is going to be there in the first years. The anatomy, physiology and biochemistry, all of these department will be teaching you how to treat the patient and move ahead in your career. Right. And nowadays the passing marks are no more 37%, they are going to be increased, they are increased to the 50%, right? So you have to get the separate 50% mark in the practical as well as the theory exam. Nowadays there is some meeting going on, it may be possible that you will be getting 50% in combined, but the NMC guideline says that at least 40% should be there in one examination. That means if I divide that into two things, that is theory as well as practical, you can get combinedly 50%, but then separately at least you should have 40% in one thing. So please remember, don't take the practicals lightly. And the CBME also incorporated the 20% MCQs in your practice, because that is very objective way to clarify that which students is actually having the concepts very well read and they can apply it. So MCQ is something which is going to be there, and you have to practice the MCQ. What do you say, sir, about the MCQs?
Definitely, ma'am. If we make proper practice for the MCQs, then our theory concept becomes clear. And remember, beta, after this NEET UG, you will go for the NEET PG INI-CET, where you have to give only and only the MCQ exam. So please read thoroughly your textbooks, build your concept properly, and immediately go for the MCQs. This is very important.
Sir, how the cerebellum is going to help in the solving MCQs?
Yes, dear students, always remember, आपकी जो ये मोटी मोटी किताबें हैं ये आपको डिफिकल्ट लगेंगी. सो आवर टीम इज हैविंग ऑल द सिंप्लीफाइड वीडियोस. आप पहले वीडियो देख सकते हैं, देन यू कैन लर्न द थ्योरी. ऑल्सो इन अवर सेरिबेलम ऐप देर इज द MCQ बैंक, यू कैन सॉल्व देम. और यहाँ पर टेस्ट सीरीज कंडक्ट होते रहते हैं, यू कैन पार्टिसिपेट देयर, एंड इन दिस वे यू विल गेट फ्रॉम द बेसिक्स टू द टॉप लेवल ऑल द एक्सपीरियंस.
Sir, can I practice the NEET types of questions in the QBank also?
Definitely, ma'am. In our Cerebellum app, there is the entire previous year question for the NEET PG as well as INI-CET. तो बेटा फर्स्ट ईयर के जो भी सब्जेक्ट आप पढ़ रहे हो, इमिडिएटली उसके MCQ बैंक भी आप सॉल्व कर लेते हो, तो आपको नीट PG के टाइम में ड्रॉप लेने की कोई ज़रूरत ही नहीं है. प्रॉपर फोकस कीजिए और साथ में अपनी नॉर्मल लाइफ को एंजॉय भी करनी है. इसके लिए हमारा जो सेरिबेलम टीम है वो आपकी स्ट्रेस को पूरा कम करता है.
Sir, if I get stressed too much or if I do not understand by myself reading after reading the questions and answer, that if let's say I do not get any topic, can I contact the faculties?
Yeah, definitely. At our cerebellum team there are our Insta group, there is the YouTube channel, there is a Telegram channel. Even हम सभी टीचर जो अपने पर्सनल नंबर हम अपने टीम को, अपने स्टूडेंट्स को देते हैं, आप डायरेक्टली आप कॉल कर सकते हैं. वी पर्सनली टॉक टू देम एंड गाइड देम. सो देयर इज नो वरी फॉर एट ऑल. एंड आपको बस अपनी पढ़ाई पर फोकस करनी है, जिसके लिए हम हमेशा आपके साथ रहेंगे.
Right, sir. So please remember, student, with that, I will say the next point, that is, there is a difference between recognition and remembering the things. What happens is, you go through the chapter, you think, your brain thinks that you know that stuff, but when you start answering them, you won't be able to get what I should write and how I should write. For that, you have to do a smart study, especially in physiology. Remember, there are going to be many concepts, there are going to be many stories which can be interrelated, and they will be in the very tangled way. You have to entangle them, and you have to make a flow charts, you make the stories, you make the mnemonics, and they are going to help you out in the main exam also. For that, you have to go through your university 10 years questions and question banks. So see the previous year question and start studying. So do the retrograde study, and that is going to help you out कि ये question अगर आया, if this question comes in the exam, what I'm going to write. So in the exam, you will not be stressed that what points I should cover, because that thing is prepared in your mind already, right? Okay. So that is going to save your time also. And as sir said, that the hobbies are very important to reduce your stress, right? So you have to do the balance. Again, the homeostasis is always important. Have that balance in your personal life as well as your professional career, right? So that with that thing, let's move on to the next thing. That sir, what's your experience of the Viva?
मैम थ्योरी में तो कुछ भी लिख के आ जाओ, कौन देखता है या कौन किसको डांटता है. लेकिन जैसे पिछले पार्ट में भी हमने देखा था कि डॉक्टर GRG सर ने क्लियर कट कहा था, प्रैक्टिकल एग्जाम में आपको जलील किया जाता है. सो स्टूडेंट्स, आफ्टर वाइवा जिंदगी बर्बाद हो गया. एंड देन टीचर्स ड्यूरिंग वाइवा,
टीचर्स विल से इनको तो आता ही नहीं है, इनसे होता ही नहीं है, बिकॉज नो मैटर हाउ मच वी टीच ड्यूरिंग द क्लासेस, यू विल बी टेकिंग द प्रैक्टिकल्स वेरी लाइटली, बट देन आवर एक्सपेक्टेशंस आर ऑल्सो देयर फ्रॉम यू गाइज. एंड प्लीज थोड़ा तरस खा के अच्छे से पढ़ाई करो.
करेक्ट मैम.
So with that, we'll come on to the integration. We are having the integrated learning part right now, and we are talking about the physiology and anatomy. So whenever we teach CNS system and special senses, what you will advise to the students what they should carry forward, or how they should integrate with the physiology, the anatomy, how they should integrate.
करेक्ट मैम. बच्चों एक चीज को ध्यान देना, when you will learn the anatomy, you will cut the structure and you will observe the structure. काटो और देखो, एना मीन्स टू सी, टॉमी मीन्स कटिंग, मतलब काटो और देखो ये एनाटॉमी है. वाइल फिजियोलॉजी मीन्स फंक्शन, वही चीज काम कैसे करती है वो फिजियोलॉजी है. सो इन अवर एनाटॉमी यू विल कट द क्रेनियल कैविटी, यू विल सी द ब्रेन इन योर हैंड, वहां पर क्रेनियल नर्व देखेंगे, यू विल सी द आई बॉल, यू विल सी द ईयर. एंड द सेम थिंग आपकी फिजियोलॉजी में पढ़ाई जाएगी, और वो चीज़ें काम कैसे करती है, हाउ द न्यूरॉन्स आर वर्किंग, हाउ द क्रेनियल नर्व्स आर वर्किंग, तो ये फिजियोलॉजी में. और बेटा जब यही फिजियोलॉजी और एनाटॉमी एबनॉर्मल हो जाती है तो ये आपका मेडिसिन बन जाता है.
Correct, sir, correct. So, till now, what you're doing is your body is functioning, but you don't know how it is functioning. So, now what is the difference that you're going to see is not only your functions are happening in your body, but you'll know that how they are happening, right? And many a times, sir, whenever I read physiology and something lesion is there or something happens and the symptoms are written, sometimes I can correlate those symptoms with me, and half of the time I feel like this disease is in
Correct.
me.
Correct,
So,
correct.
do you also feel the
या
same?
बट इसको मेडिकल स्टूडेंट सिंड्रोम बोलते हैं। आप मेडिकल फील्ड में आगे जब भी कोई चीज़ पढ़ोगे तो एक बार डाउट होगा, अरे ये बीमारी तो मुझे है, ऐसा आपको फील होगा। तो बहुत इंटरेस्टिंग होने वाला आपका आने वाला टाइम।
Right, sir. So you have to differentiate, right? And the patients will be coming to you with lots of symptoms. You have to see that whatever symptoms are necessary or very important to that time, you have to make the differential diagnosis on the basis of that. Right.
एंड ऑल्सो मैम फॉर द इंटीग्रेशन आप एनाटॉमी में थोरिक्स को ओपन करेंगे, हार्ट को अपने हाथ में लेकर के देखेंगे, एंड इन फिजियोलॉजी यू विल सी द एक्टिविटी ऑफ द हार्ट। आप एनाटॉमी में बेटा जीआईटी को ओपन करेंगे, स्टमक, इंटेस्टाइन, सभी चीज़ों को हाथ में लेकर देखेंगे, किडनी को हाथ में लेकर के देखेंगे। इन फिजियोलॉजी यू विल लर्न हाउ द यूरिन इज फॉर्म बाय द आवर काउंटर करंट मैकेनिज्म, सेम विद द आवर पेल्विक कैविटी एंड द रिप्रोडक्टिव सिस्टम एंड नर्व मसल फिजियोलॉजी यू विल लर्न इन द फिजियोलॉजी। और वो सारी मसल को आंखों से आप अपने बॉडी में देखेंगे, वो बोन्स को अपने हाथ में रख करके पढ़ेंगे एनाटॉमी में। सो दिस इज द ब्यूटीफुल इंटीग्रेशन यू हैव टू लर्न इन इंटीग्रेटेड अप्रोच।
Right. So there are two types of integration. One is horizontal, which is going to happen in your own ear subjects, such as sir said, anatomy, physiology, and biochemistry. Then you are going to have vertical integration, that as you are going to move on forward in your career, let's say second year and third year, then you are going to have the vertical integration. If you do not know any of these subjects, you will not be able to integrate those things with the other subjects, right? So with that, let's move on forward, that whenever you realize that it's an exam time, right, we feel that we should have studied more. So do you feel such things
डेफिनेटली
now?
मैम, डेफिनेटली। बेटा याद रखना, जितना भी पढ़ो कम ही लगेगा। मेडिकल साइंस अगाध है, अपार है, ये समंदर है। यू विल स्टडी मोर एंड मोर, लेकिन ये कभी खत्म नहीं होती। एक डॉक्टर जो होता है वो जिंदगी भर प्रैक्टिस करता रहता है। वो अगर 90 ईयर का भी हो गया तब भी वो बोलेगा कि यार मैं प्रैक्टिस कर रहा हूँ। यू विल नेवर देयर इज नो एंड ऑफ द नॉलेज, देयर इज नो एंड ऑफ द प्रैक्टिस।
Yes, sir. Even if when I teach the thing, sometimes it clicks to my mind that, "Arey, aaj to I taught it differently, and there is an improvement I can see in my classes itself when I'm teaching at this level also." So please remember, guys, there is no end for the improvement. You can improve all the time, but for that you have to practice every time.
And for this all kind of the hurdles, our Cerebellum team, all the 19 legend top educator of the India, we are with you। और साथ में बेटा आप हमारे फर्स्ट प्रॉफ पैक में एनाटॉमी, फिजियोलॉजी और बायोकेमिस्ट्री के स्पेशलिस्ट की मदद ले सकते हैं। वी विल बी ऑलवेज विथ यू। आप पहले वीडियो को सिंप्लीफाइड तरीके से देखिए, फिर उसको टेक्स्ट बुक के थ्रू पढ़िए, उसके एमसीक्यू बैंक्स बनाइए, टेस्ट कीजिए। साथ में हमारा फर्स्ट प्रॉफ और साथ में सेकेंड ईयर के बहुत ही टॉप एजुकेटर, द बेस्ट टीचर ऑफ द आवर इंडिया, वी ऑल विल बी विथ यू। सो दिस इज ऑल अबाउट अवर टुडेज सेशन। आगे भी हम आप लोगों के लिए गाइडेंस करते रहेंगे।
और ये चीज़ भूलना नहीं that your departmental instructions are very very important, because they are the ones which are going to make your university question papers also, right? With that, I have a very wonderful thing for you, that is, faith is to believe what you do, not see. The reward of this faith is to see what you believe, right? So believe yourself and keep on reading, keep on studying, and enjoy the life.
Correct.
Right?
Correct.
So with that, we'll say thank you very much.
Thank you.
And if you have any more doubts, you can contact us.
लास्ट फ्यू लाइंस फ्रॉम माई साइड में।
Sure, sir.
सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए। हमारे सीने में नहीं, तुम्हारे सीने में ही सही, कहीं भी हो आग, लेकिन आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए। थैंक यू डियर स्टूडेंट्स, स्टे ट्यून्ड।